It is estimated that almost 165 million people suffers from mental disorders every year in Europe.
Krka Talks podcast, where we share knowledge and personal thoughts with healthcare professionals and the general public.
Welcome to Krka Talks with the topic of mental health. My name is Ante Silić. I'm a psychiatrist. I work in University Hospital Sestre Milosrdnice in Zagreb. And today I'm proud to host and to present to you my dear colleague Nuša Šegrec, also psychiatrists with the area of expertise in dual diagnosis. And we will be talking about mental health, about difference between recovery and remission, and about dual diagnosis. What does it actually mean? So the podium is yours.
Thank you. Yes, I mostly work with patients with dual diagnosis, and I think the recovery and this question of recovery goes into this topic because
Definitely.
This is very complex. These are patients with very complex needs. So we always want recovery, but we need many steps to do and to achieve to reach the recovery we actually want. And
so when we say dual diagnosis, well, I think that most of young psychiatrists or residents do not grasp the idea. What does that duality means? It's a comorbidity of this and that. What can you explain to us a little bit?
Yeah, I think it's a little bit older term because I don't like it because people are not diagnosed. I think that it's a little bit stigmatizing, that we always try to find a better word. In Slovenian language, we didn't find a good word for this patient. So we try to at least say these are patients with comorbidity of one mental disorder and another. But in Anglo-Saxon world, they mostly use the term patients with complex needs. And I think it's less stigmatizing and actually tells more. So that means that someone has substance use disorder and comorbid mental disorder. And this complex needs, a term goes from complex needs of these patients because they really have different areas included, which can be by the disease affected. So that is in short what dual diagnoses are. We also use term multiple diagnosis because they also have somatic disorders.
It's usually more than two. And one other word that I would like to talk about with you is the recovery. We have been using that word not that long ago since we started to use it. Is it because we have the luxury to use it now, or we are trying to change things? What's happening with recovery? How is recovery different from remission?
How is the recovery different from remission? Yes. We have to focus on different phases of the treatment, if you agree. Of course, we want symptomatic recovery. We want for patients that symptoms relieve, that he's not so under the influence of it because it affects everyday living. We all know that. But it's not the symptoms we want to get rid of, if I can say so. But recovery is much more. Of course, it's very personal term also because we don't have this medicine anymore. I hope so. One fits all, but we need to go in the way of more personalized medicine. So, of course, we can talk general about recovery, but I think for every patient, this is very important to have his own goals, short-term, long-term, and then try to achieve some changes of course, we all want pre-morbid recovery or,
all of us.
or even better functioning, but we have to be realistic. So
That's exactly the key is in the, as I see it, is in that added value. We are not just teaching and helping patients up to a point where they can somewhat function. We are aiming for full functionality. Whatever on the individual basis that means for each individual patient. Sometimes we as professionals have different expectations from treatment than our patients. I would say maybe most of the times. How to make amends between those two different actually goals?
Yeah. I remember this study now when you mentioned this area. There was a study about healthcare professionals and patients' expectations in treatment according to different phases of major depressive disorders. So in acute and then in following phases. And actually in the acute phase, mental health providers were more focused on symptom reduction. And I think, if you agree, we do this in practice. I always try to help patients to relieve maybe insomnia or if the inappetence, if they don't have appetite, or in psychosis, if they have acute psychotic symptoms. So this is our focus. But when they look to the patients' expectations in the acute phase, they were different because they also want this functional recovery. So back to work, good relationships with the family, social life, they want to improve. So in the acute phase, there are differences. But the second phase, when the progress is achieved, the goals are similar.
So eventually we find the common grounds, but it takes some time.
Yes.
It's good to know. I think that I know the study that you are mentioning, because it was rather surprising for me that sooner than us, our patients look at the functional recovery and long-term outcomes. And we are focused on the leading symptom, and we think we are both right, but we should be aware of this one, because by actually addressing that and just explaining, psychoeducating our patients that we do have the same goals, but maybe not sorting them out on the same scale, that helps a lot and eases the tension in the most of my patients, at least if we get the time to talk about it. Another interesting question that I think that should be addressed is when we look at the global burden of disease. Where is mental health today? Has it finally found its place? Unfortunately, on the top, or not?
Mental health is integral part of health, and we agree with this definition of World Health Organization, and we agree probably that there is no health without mental health. But unfortunately, there is a high percentage of mental health disorders among European Union citizens, estimated. So it's estimated that almost 165 million of people in 1 year has symptoms of mental illness. That is a very high number. Do you agree?
Yeah, absolutely. And that's the World Health Organization actually gave us that definition. There is no health without mental health, and that's a good one. But that was just a theory. Now we are getting it closer to the praxis. I think that they were predicting that by 2020 it will be on the second place, but it surpassed that expectations, unfortunately, again. Probably one of the reasons, not only the global economic and political and geopolitical turmoils and wars and stuff, but also the COVID pandemics that hit us in places that maybe we didn't expect that much, because as I recall, if I recall well, you mentioned that adolescents were hit the most in the COVID pandemics. And well, globally, we are getting there.
One of the most, yes. Yeah.
Mm-hmm. So we are getting there. We are recognizing the needs and the resources that have to be invested into treatment and recognition, diagnostics, individual approach, and everything.
I agree, absolutely.
Same here. So thank you very much for sharing these insights and thoughts with us. If you had to conclude and give us the final thoughts about the topics that we covered today, what would they be?
I think that it's very important that we start with good diagnostic procedure in every patient, with screening, diagnosis, individual goals with the patient. We are a team. We are not alone. We have to involve, as it is possible, important others, of course, if patients want. We have to involve other specialists, other professionals. Now we have such a good programs. I'm talking about integrative treatment program, which we say is also holistic approach to treatment to achieve functional recovery, towards functional recovery. So we have plenty of opportunities, and we have to be aware of all these factors which can reduce the success of recovery. We have to be very patient with our patients, because we have patients with chronic diseases, and sometimes these steps are very, very slow, even though we want very, very fast changes.
Okay, thank you very much. Yes.
Thank you.
Thank you. And thank you for following this Krka Talks, and hope to see you on the next one.
Krka, because we stand by you for health, knowledge and motivation.